Yeah, I'm giving the responsibility of closing meeting in 5 minutes, and I will do that in 5 minutes. But I would say this last panel was outstanding. And we finished on a very high note indeed. So I had a great 2 days. Did you? Yeah. It's certainly one of the best in my mind. And, you know, when we started this initiative, Mike and myself, Mark and others, we saw the importance of course, doing something that would be impactful, if you will, for the policymakers or influential, shall we say, for those who are going to make decisions around healthcare nationally, quickly recognizing, of course, about the importance of state and local actions, which is why we're here. And we want to spotlight North Carolina because of everything I know, everything we read, and really the sense of at the edge of transformation, if you will, of health. And I would say this meeting exceeded all our expectation. We learned about the aspirations, the priorities, the enormous efforts of the people in this room and everyone else. And of course, there are also lots of lessons learned. And for us, we learned about your successes, also learned about your failures and challenges. And this is going to be very helpful to us as we bring back to the Academy to think about how to continue this journey in working with all the other states, and particularly using the lessons learned we have here, how we can inform how other states can move forward. I'm very optimistic about what I learned all those 2 days. Despite the setback, I think North Carolina has a great future. It's mainly because of the people with shared vision and shared goals, better health for all, and the whole idea of health beyond healthcare, and whole idea for everyone. You have the ingredients of success. Leadership, I mean, we've seen this throughout the entire meeting, the leadership at every single level, grass top and grassroots. It's about really believing in a better future for our people, present and the future. You have talents, compassion, and commitment. That comes across very clear. And now you're developing the tools and the approaches. It's hard work. We heard about the alignment of the payers, the providers who are trying to move in this space and learning the tools and making adjustments. It takes a lot of courage, and it does take political will. And certainly it takes systems change. But as I see it, system is us. And as I said in the last comment, I think that collectively you have much louder voice than you think. So I agree with Julie and others that narrative counts. And certainly in Washington, we know narrative always matters. But collectively, you know, your voice has to be heard by the citizens. And I think someone talked about communication at the end. Communication is so important. We learned that at National Academy. We can't do a report, make recommendations, and nobody reads it, and nobody cares about this. So I would argue that with the kind of energy in this room, the people in this room, with all the people, the stakeholders, there ought to be, I guess it was said by Josie or whatever, certainly it was, I think, Reverend earlier said, you need to meet every other week. Well, every week. But I think the issue is not meeting, but what are you saying collectively? And how do you actually bring it to the public? So people really gets it because they trust you, they want your help, and in fact, your voice matters, your collective voice is even greater. So the way I look at it is, despite the recent setback, I think there's a lot of reason to be optimistic. Just think about this. You're on a journey to look at how to create better health by looking at value-based care and looking at social drivers. Well, you know, you're already on the way there. with or without expansion of Medicaid. In many ways, if you look at your goal of 70% of alternate payment model or value-based payment in a period of time, I think it's 5 years. You got Blue Cross. I mean, you don't have a lot of commercial payers. So to a large extent, the payers are aligned. And you can continue that journey, in my opinion, and just reaching that goal alone is amazing. It'll be the first in the nation, in my opinion. North Carolina is the forefront of healthcare and health transformation. And as the article in Health Affairs says, no other state is on track to reform payments so much and so fast. I think we need a sense of urgency. I think we say our people need it. If you hear the stories, you know so many people need this change, and people are depending on all of us, depending on you. We at the NAM will be your biggest champion. We'll take these lessons learned, the messages, and bring it back to the rest of the country. We want to work with you and continue to work with you. As been said, we'll have a publication at the NC Institute of Medicine Journal, and of course, working with Adam Zoliter. Is he still here? Somewhere. And others will be getting back to you. But we look forward to hearing all the things you're doing, and whatever we can do to help, please let us know. And thank you for a wonderful 2 days. Thank you. I do have to thank, by the way, of course, Jessica Marks, right? And is Jared here? Jared Newen? There he is. Simmer here. And, oh, Sammy, sorry. Sammy's here. And Ivory, and of course, Mike McGinnis. And of course, the steering committee and Mandy Cohen. Thank you very much.